And ready to go. All right. Well, welcome everyone. Thank you for joining us and thank the panelists for being here with us today so we can have this conversation that's just so needed every day, all day with that, between us and then with the community. I wanted to just go over a quick purpose of the panel. So we're hoping to address some of the common mental health issues and challenges facing veterans and their families, some coping strategies that we can figure out to better support them in their daily activities, resources, and then community support, which we all need, because sometimes we just are looking for someone to talk to, and if you don't know where to start, you just don't know where to start. So hopefully we'll open some doors for everyone today and more starting points to find support that we need. We are at 103. Who's the audience? Our audience today, we're hoping that we have a wide variety of participants from veterans, family members of veterans, military connected folks, community partners, and then basically just anybody that wants to learn more about what's going on in this space. We have an amazing panel. We have Shad, Meshad, who's the founder and CEO of the National Veterans Foundation that's been around for decades and decades. And Shad has been doing this work for almost 50 years. And then we have Ava Weiss, who's representing the Cohen Clinic, which is newer to our space, but is a fantastic model that has been helping veterans for a lot of years now. And then we have Dr. Lynn Morrell, who has, like Shad, just been doing so much work for people to help them recover and move past and have a better quality of life after trauma. We have Esperansa Perez, who is working at the vet centers or vet center. So she's going to be able to provide an opportunity and avenue for support for there. And then we have Jim Zenner, who's currently the director of the LA County Department Military and Veterans Affairs. And I'd like to mention that Shad, of course, Esperanza and Jim are all veterans, and Ava is a veteran spouse. And Dr. Lynn's she's just immersed in our space and our community. So we're super glad to have everyone. And we're going to have our panel for 1 hour. And then at the end, we'll have a additional question and answer session. So you're welcome to join there. If you have questions throughout the panel, please put them in the chat. If the panelists see the question, they're available to answer it as we go. Otherwise, we'll be answering all the questions at the end. And this is being recorded, and we're going to share all the resources and questions on the NVF website afterwards. So if you want to share with somebody else after the fact, we'll provide the link to you with a follow-up survey after the Zoom session closes. So that's what we have, and we're super excited to get started. So I will start with Shad. We're going to move into our first question. So my question for you is, in your 50 years of experience working with veterans, what has consistently been the biggest obstacles for veterans and their families when it comes to addressing their mental health needs?
Biggest issue has been, since I hit the streets out of Vietnam in '71 here in LA, is knowing where to go, who to talk to, who to communicate with. Obviously, after the first 2 years in Los Angeles working all over the city, I realized the main thing is to connect with them. That was a different period, but it's really important for them to know where to go. My first national program, the Vet Center program, was set up. I set the first 100 up from Puerto Rico, Hawaii, and Alaska. But still, it takes time for people to go to a location. I think the peer-to-peer program, one that I really love that Jim and Dr. Sharan developed, that's going now, VPAN, is one of the programs that has peers going out there and communicating and finding them. That's the biggest problem. I mean, you can sit in any organization and say we're ready to counsel them, but war veterans particularly, and even their spouses and kids don't know where to go. We spent about $2 million advertising the Vet Center in the first 5 years, and people still didn't know about it. And that was on TV or whatever. So I like, particularly like our program, where we put the word out that call us on anything. A lot of programs are focused either on transition or just counseling or whatever, but to have a place to go to say, hey, you need to talk to Jim Zenner. You need to talk to Ava. Let me send you over to Lynn. Let me send you over to Esperansa. That's what that's been my success. Obviously, I'm just a grain of sand on the beach because, you know, this country's real big, but it's very important to get the word out. They have a place to go to ask any question. And they're not going to say, well, I think I need a mental health clinic. I think I'll call the Cohen facility or whatever. It doesn't work that way. And I think that's been the big failure with the VA. It's because they expect you to come knocking on there and entering this bureaucracy to talk and get acquainted. It doesn't work that way. The hand is up.
Fantastic. And so I just wanted to mention that Shad is talking about the National Veterans Foundation. So we have the website, nvf.org, and then the phone number is, we'll talk about it all through the time and we'll put it in the chat, 888-777-4443. And the team is veterans or family members of veterans. So you're going to talk to somebody that understands, and we'll get you connected to who you need to get connected to. All right. Thank you. So our next question is going to go to Ava. And I'm going to ask, how does military culture impact mental health awareness and help-seeking behavior?
I think that's a fantastic question and a very big question. And I know we've got just a little snippet of time now, so I'll try to just kind of some of the kind of big pieces that I think are really important here that we can all recognize is that, I mean, the military community is really diverse. The military and the veteran community are really diverse. There's no one answer that fits all people. But there are many ways in which there's some shared aspects of military culture that I think we can recognize in a lot of our community. And I think some of those pieces can be real strengths, including like there's an emphasis on resilience, there's an emphasis on doing for yourself what you need to, sticking it out, you know, on warrior toughness and all that stuff. While those can be real strengths in certain moments and in certain contexts, they can keep you alive, keep you going. There are other moments in which an emphasis on having to do everything for yourself or having to remain really tough can, when what you're facing isn't an external enemy, but is in fact kind of the complex realities of just like navigating a stressful world. Sometimes those same qualities can get in our way. And so I think that's one piece that I think can be really important to pay attention to is, am I expecting myself to take care of everything by myself? And is that fair? Is that reasonable? We're all interconnected as people, like nobody gets through it alone. And that's true for everybody's military experience too. And so like knowing when to take a knee or knowing when to reach out for support can sometimes go against instinct, but can be extremely important. Because all members of the military and veteran community also are trying to navigate the stresses of life, the realities of loss, of things that are painful, of stuff that happens just like anybody else, but also with some added, with potentially some added aspects of stress and of difficulty that might be unique to those who are kind of navigating through the military or following after a military career. So, you know, nobody has to do it alone. And there's roles for all of us to support each other in this. So I think that while the drive towards help-seeking behavior sometimes can be lower for people who feel like I really need to rely on myself, it's also it's one of my favorite things to emphasize that like we are here to support each other, just like any other situation you've been in where you've supported the guy next to you. So that's my tiny spiel on it, but I could talk for hours on it.
No, that's awesome. Thank you. Thank you. So our next question is for Jim Zenner, and I'm wondering, how can veterans and their families transition back to civilian life while maintaining good mental health?
Yeah, well, I mean, first thing to understand is, and I don't think the system understands, is we don't transition out of the military into a VA hospital. And right now, the way the system's set up, it's really not, it doesn't embrace the power of local government and the local communities. It's, you know, federal to federal. It's not federal to state to community. And that's the biggest barrier that kind of, you know, sets us up to fail as we transition out of the military. As far as mental health, I mean, it's really important to just listen to, you know, those around you. Like you come out different. The family comes out different. Everybody comes out different. And so, you know, as you're kind of interacting with your social circles that, you know, didn't go in the military, that were part of your life, or maybe they weren't a part of your life while you're in the military, but they knew you before the military. If they're talking to you about like, wow, it seems like you're really, you know, you short fuse these days, you know, what's going on with that? You know, things like that, like really kind of listen, because they're going to be the best kind of temperature gauge for you, because you're not going to see the way you change. You're not going to see what others will see in you. And that's probably the best way. And just really making sure that you have good social support. You know, it's some people choose to hang around nothing but veterans when they transition out as a veteran, and you know, that's a choice. But by not really exposing yourself to the civilian community and kind of reacclimating, you're kind of setting yourself back in many ways, because you have to get used to people not understanding acronyms. You got to get used to people looking at you funny when you're like really assertive, which was normal in the military. So, you know, it's really kind of, you know, put yourself out of your comfort zone, expose yourself to stuff that might, you know, frustrate you a little bit in manageable doses, and then just really listen to the people around you, especially the ones that knew you before you served in the military and when you get out.
Yeah, I love that comment, listen to those around, because that's probably one of the hardest things to do for us, would be to hear, wait, what, I'm not okay? Like, yes, I am. I think I'm doing good. I'm using everything that I had previously. And but that is just a very true comment. And if I can add into that, like the importance of really not being, I mean, it might take you back a minute, and it might like really not settle well with you if your network and your people and those close to you are telling you things might be wrong. But yeah, if we can just take the moment to really listen and identify that we just might need a little bit of help. So that was a great point. Thank you for that very much. Next, we're going to move on to Esperansa. And I was wondering if you could provide some insights into the unique mental health challenges faced by women veterans.
Well, thank you. I have a very personal answer to that. You know, I'm one of those veterans who asked for a female provider when I first started connecting with just any therapy at all or any medical services. So, you know, one of the things that you know, coming to the vet center was difficult for me because I knew that the vet center was a male dominant environment, given the history of it. But you know, I truly believe in the idea of meeting people where they're at, and I needed that when I came out. So I also see the value of having our civilian providers in the teams, and having that non-biased look into our military culture. So I want to thank those on the panel who are civilians, and also want to shout out to you and to tell you that you're valuable in the community of veterans. Kristine, I don't want to go far from the question, but can you repeat it one more time?
Just some of the unique mental health challenges for women vets.
So the space is being women friendly. Just, you know, like the vet centers. Every vet center is different, right? So, but for me, it was kind of scary to come on board with an all male team. And just because of the interpersonal issues that I've experienced throughout life, and especially in the military. So if we make these spaces women friendly, if we, you know, allow women to come in and make it their kind of home also. So you know, every setting we should make it women friendly. Also meeting them where they're at and allowing them and to, you know, giving them what they're asking for, right? So if they ask for a female provider, I'm an advocate for that. And the reason why I'm in the vet center is because, you know, I wanted to represent and I wanted to be a provider who can meet women where they're at in their process, in their journey, and their growth. It's really difficult sometimes to be able to meet them where they're at. But if more of us allow that and make it a welcoming female veteran environment, we can do it. And what else? Everybody, you know, it's everybody's business, really. It's not just the females that should be out there promoting female spaces, the males. And, you know, I want to thank Shad and Jim for being, you know, a male who support the women movement. And I've seen you out there and I appreciate you. So thank you.
That's awesome. Thank you, thank you, thank you. All right. Last but not least, for our first round of questions, Dr. Lynn, why are alternative mental health resources so important, especially considering those that prefer non-VA support?
It's a really great question. I've been around veterans for most of my life, not only veterans of Vietnam and so on, but veterans of trauma that have been left gutted. And the one thing that's been most valuable is when we meet them where they're at. You know, some of them come in. I've had guys come that called and they had shotguns to their head, and I told them to get their ass in gear. And if they still wanted to kill themselves at the end of the weekend, good on them. But that never happened. They just got what they needed. And it's been such a don't talk, don't tell from what I've seen from the outside looking in, with a nephew as total disability after being in Afghanistan, a Marine. And I'm not quite sure I'm targeting your question. So can you repeat it one more time?
Basically, why is it so important to have other options outside of the VA to help with your mental health?
Well, actually, one size doesn't fit all. There are those that would never, ever talk about their service. I've worked with them. But when we find that there are like-minded people, even if they've not been through what veterans have been through, but they can hold a space to listen without trying to give them opinions and judgments. But really, what my experience is if you love them where they're at and allow them to open up like a flower that gets watered, especially the female veterans, the ones that I've talked with. You know, it's very hard coming from that environment that's been traditionally male dominated. And I've worked with a lot of female vets who didn't feel that they could share. But when you're in a safe place, that's a natural process because we're made for community, men and women. And so when we can hold a space, we don't know what they're going through. We don't even know what they need. But if we hold a safe space, more often than not, they'll open up on their own. And the most important thing is respect. Respect and honoring and caring. that's done more in the last 40 plus years of my work with trauma than anything else. You know, it's a journey, and if it doesn't kill you, truly, if you work on it, you will discover who you are from the inside out, and trauma does not have to define us. We can use it to gain wisdom, understanding, and compassion. I think that's almost my 3 minutes, so thank you.
No, it's perfect. It's perfect. I just kind of want to take, before we transition into the second round of questions, is some of the common themes and statements that you all have said is, you know, we can't find resources. And then everybody has said, meet them where they are. So like, how important is that to just accept someone for who they are right now in front of you and just listen? And that was the other thing. Everybody said, listen. And you all mentioned like one size doesn't fit all. So just being able to, you know, take the moment to listen, acknowledge, respect, that's a fantastic way to address it. And then, you know, we all talked about women veterans and how our journey can be uniquely different. Whereas, you know, in Esperansa, I think it's a really good point. Like, not only do women veterans need to come forward and ask for help or seek support, but there needs to be providers available to meet us when we get there. So that's fantastic. Fantastic. All right, so we're going to move into our second round of questions. And then this is going to be a little bit more how to address and resolve and connect and get the support that you need with the questions that we've already been bringing up in the topics about addressing mental health. So we're going to start with Esperansa. I'm going to go in a different order, so we're going to mess it up this time. So Esperansa, as a woman veteran, as a social worker, as a therapist, as a family member of, you know, as the military member in your family, how has the Vet Center supported you, and how do you see it improving the lives of veterans and their families? So like, this is tell us about the Vet Centers and what we can find there if we walk in the door.
So it's everybody's business, right? It's not just the provider's business to provide the services. I think our families should be involved. Our families should understand the crisis line, should be able to sit down and help somebody in crisis, kind of dial, and then, you know, just sit there and help them be a presence while they're dialing 988, right? And but also the Vet Centers are a drop-in center. We're not, although we are known for the barriers for eligibility, we do not turn anybody away. Anybody can come into the Vet Center and find out if they're eligible, because the eligibility has expanded in the last year. And we are seeing different eligibility. So what I suggest is that you go into your local Vet Center and meet your local Vet Center team and ask what the eligibility looks like for them. Every Vet Center is different. For our vets, go and meet your Vet Center team. And, you know, we have from LCSWs to MLT, you know, marriage and family therapists to psychologists in our teams. And not everybody has a marriage and family therapist or a psychologist on their team. So it's important to go and understand your local Vet Center staff and the services that they provide. A lot of Vet Centers provide couples therapy, and we use the Gothman model. So we're pretty different in what we provide. So for me, going back to your question, for me, when I first came into the Vet Center, I had a very, very different experience. I did not find it welcoming as a female veteran, so I did not use it for myself. I did not use it as a provider for me. And I went elsewhere. So again, the relationship is built on trust. And going back to Dr. Morel's comment, you know, if that trust is not built, then we're not gonna go. And a lot of our vets struggle with trust from Vietnam and other conflicts to now. So trust is important, and taking them to a place where you know they're gonna build trust is important. And family members can do that. They just need to reach out, ask questions, and be able to meet the teams, you know, go to the Bob Hope and understand the services there. Go to the vet center, local vet center, go to the local VA and just ask questions. Just get familiar with what's out there as a resource. Attend stand downs. We have stand downs all the time. We have outreach events all the time. You know, ask questions so we can get what our veterans need. And a lot of the times veterans don't go because they're avoiding, because they're, you know, it goes with the trauma. It goes with what they're experienced in the past. And even for female veterans, you know, they don't want to be around males who they've experienced MST, and males who are obnoxious and you know, they talk about every other work is a bad word. So, you know, they don't want to be around that. So making sure that they are in a place where they can trust someone and allowing them to find those spaces and making those spaces for them. Kristine, I hope that answers your question.
Well, I have a couple more for you. So
Okay.
there we go. The primary mission of the vet centers is PTSD support and MST. Can you talk a little bit about somebody's eligibility for if they've experienced MST, which is military sexual trauma? And I'm not lumping just women, it's men and women. And potentially maybe they don't have like eligibility for the VA, but would they be able to come see you?
Yes, no questions asked. If it's an MST case, we don't ask questions and we see them for MST. And we know that MST is not only experienced by women. We know that men are coming and talking about their experiences. And we also, you know, I share with you guys the eligibility reference information, Kristine. I hope that you put that into resources. But no, the eligibility is not just combat and MST. We do also offer bereavement services for family members who have experienced a suicide. We also offer, you know, National Guard is expanded to the National Guard members. And we've just recently expanded to educational, to anybody using their education benefits. So all it takes is to ask and come in and see if they're eligible. Mm-hmm.
That's fantastic. Thank you. And we have put in the chat how to find a vet center. So the link is there. Esperansa has also shared that when you put in go to the website and look up your vet center local to you, it'll list the services that are provided there. So if you know someone or if you yourself are looking for some support from the vet center, me personally, I know I've used it. They do extracurricular activities. And one of, you know, the great things about the vet center, it's not in the big VA hospital, it's local in the community. It's much more welcoming, less intensive, you know, going into the big VA hospital. And then they do extra stuff. I went fly fishing. It was fantastic. There's equine therapy. There's a bunch of things. I know she's with the East LA Vet Center and they're looking to do golf for veterans. So also the hours are a little non-traditional. So there's some evenings and that will show up when you look up your vet center. And she did mention that there's I believe it's 24/7 answering service. So if you call after hours, you will get to talk to somebody. They'll take a message and you'll get a call back. So I think that's fantastic. Thanks, Shad, for having the foresight to set up vet centers.
Yes. Yes, thank you, Shad. I did share some videos. Shad is the main character in those, so I encourage you to watch that. A lot of history of the vet centers is in there, and also we have a VPAN provider, and we also have a VSO here on Fridays. And we have, we have to thank Jim for that. So thank you, Jim, for allowing for your staff to be here. So again, it's a drop-in center. Come and meet the staff at the Vet Center.
Awesome. And the link and the videos have gone up in the chat. So thank you for finding those. All right. Fantastic. Thank you so much. Next, we're going to move over to Ava. And you're coming in with as a military spouse, a licensed social worker, part of the Cohen team. I wanted to, if you would share with us how you see the Cohen Clinics network changing the lives of veterans and their families. So the floor is yours.
Thank you. Yes, absolutely. Happy to talk about Cohen Veterans Network. So Cohen Veterans Network is a network it's a nonprofit, non-governmental, so not VA connected at all, network of mental health clinics that exist around the country. So we've got like 20 something clinics, all the way from East Coast, several locations throughout, the whole center of the country, and Alaska and Hawaii. So like a lot of locations nationwide. And the function of the Cohen Clinics is to serve post 9/11 veterans of any rate, role, discharge status, role in uniform, time in uniform, anybody who is worn a uniform in the U.S. military for 1 day or more, you count, as well as National Guard, reservists, any military family member, so a family member of a veteran, of an active duty service member, and that is a family member as it's defined by them. So it doesn't have to be like a legal dependent or somebody in DEERS. It can be somebody who is in your network and a close part of your support is military, then you are a military family member. And also some active duty service members with a TRICARE referral. So that's in particular areas, especially where there's like too much demand for care, more than the local military treatment facilities can sustain. Our clinics have partnered with in those areas to support active duty service members as well. So the mission of all of this is to make sure that veterans, active duty service members, military family members can get really good mental health care with as few barriers as possible. So the goal is to make sure that there are really short times to get into care. That cost is never a barrier. So if you don't have insurance, that's totally fine. We've got kind of a way to cover that. And also that we are providing like really high quality, evidence-based, targeted treatment for people who are dealing with some stuff that's hard and they want some support and they want to see change in their life. Like that, great. No matter what the issue is that you're dealing with, come to us, get connected, and our folks will work to help you reach those goals. When we're not like the perfect fit for somebody, then you're gonna work with our case management. We'll help you get connected with maybe a program that's for something really specific that you're looking for, or for something that you want a lot longer term care. We'll help you get connected with that. But I think, and although we make it a priority to serve post 9/11 veterans and service members, if you are pre 9/11, we can also support you either by supporting you in-house, or if there's another resource that's going to be an even better fit for you, then we're going to help connect you with that. So this is a foundation funded network of clinics. And because of that, we're able to kind of exist outside of some of the complexities of military and governmental bureaucracy. And so we're able to move a little bit faster on some things. We also are embedded in local communities in ways that make it so that you don't have to go into like a military hospital or even a vet center. If you would like something that's a little bit further removed from that, then this is an option that exists. And I say that only to say that like it's good to have a lot of options, right? Like, just like Dr. Morell, like you were saying before, it's not one size fits all. We want to have an array of options for people, and the Cohen clinics provide some options. So a couple other things that I want to make sure to say. We were talking before about the importance of serving women veterans. And one thing that I feel particularly kind of excited about with the Cohen clinics is that we serve a really high proportion of women veterans, about double the proportion of women veterans that exist in the country. So I think I just looked up the numbers, and about 34% of our veteran clients are women, and that's double the rate of the percent of women veterans nationwide. And I want to note that there is, in the Cohen clinics, our folks, I'm the senior training manager, so I take a lot of pride in how our clinicians are trained. And everybody is trained to be able to provide good, high quality, evidence-based care, and also to operate from a stance of both military cultural competence and cultural humility. So not assuming that I know everything about you, but also coming in a place where you're not going to have to explain every acronym to me. I might not know them all, but our folks are going to be prepared to, again, like everybody else is saying, meet you where you're at with a kind of stance of non-judgment, and an open door. So that's the Cohen clinics in a nutshell. And I think there's always all of us go through stuff. There's no wrong reason to reach out. And if you need support, we are one of the options that exist.
Great, thank you. I just wanted to add, in our previous conversation, you mentioned something that was so just eye-opening to me, and it was such a great connection, where you mentioned about sometimes we lose our natural network.
Yeah.
If you want to
absolutely.
just touch a bit on that.
Totally. I mean, like military families, I think you're bopping all around, you're going place to place, you are dealing with kind of the ups and downs of military life. And sometimes one consequence of that is that you might not be as connected to the natural networks that those who are able to kind of decide exactly where they want their crew to take them and maybe kind of stay near family or do things like that, those folks might have the opportunity to build strong natural networks that surround them. Military families don't often have that luxury in the same way. And so sometimes military families need a little bit of the extra support. They don't have the same robust natural networks, social networks surrounding them, or at least not locally. And so there's, in situations like that, when all people in the world deal with stressors, deal with losses, deal with big transitions. But when you're dealing with that, also in a situation where you don't have that local community of support that maybe your friends who stuck around your hometown do, that can be one of, there's no wrong reason to reach out. That's a very good reason to reach out. If you're finding that you don't have the support around you that you're looking for, that's a wonderful time to reach out for support from somebody who is trained for this, who knows how to help and who can be there for you. And that's not something that says you're not weaker. You just don't have necessarily the supports that exist in the community that our civilian counterparts can kind of sometimes take for granted. So
Fantastic. Thank you. Thank you for that. I'm going to move to Jim. As a veteran and also a licensed social worker, a director and a family member, and you've been serving for many years in the helping community, supporting veterans and their families. Can you share about, as a leader, how do you take care of yourself and your team members without compromising the mission and well-being of your team? And also, more importantly, how do leaders lead in a way that doesn't impacts like both, like the health of your team and then the service that they're providing? And do you think there's a balance? I know that's kind of a big loaded question, so take your time, and there you go.
Yeah, no, it's really important. I think that's what I've seen and have been frustrated with in the LA veteran helping community for a long time, is seeing leaders that don't understand the balance, and they cater to their employees before the mission. And part of it is taking care of your troops. We learned that in the military, as everybody that served in the military on this call understands. But it didn't mean that you stubbed your toe, don't worry about going on the ruck march today. No, the mission is the mission. I'm going to let you not run PT before we go do our ruck march, but the mission's still the mission. And too often I see just leaders that don't know how to lead in a way where there is a balance. They just let their staff get away with a lot of stuff, and that's typically when we get people and they're frustrated, it's because they ran into an organization that wasn't ran properly, wasn't managed properly, led properly. And I think that's really kind of something I've seen improve over the last several years in LA County area, but we still have some work to do. An example of when I worked at the VA, I had some of the supervisors, social workers say, our peers are veterans, like that's our mission, is to take care of veterans. So, we can't be too hands-on with them. And, I told them that's wrong. We're employees. We're here as employees. And we have caseloads of 30, 40 veterans and their families that are dependent on us. You let that one veteran not show up to work and not hold them accountable, what happens to our 30 or 40 veterans and veteran family members? You have to strike a balance. You have to take care of your staff, but make sure that they know that they're not going to get away with crap, because what you allow to exist will persist as a leader. And you let lack of accountability fester, and it's just going to grow, and it's going to get bigger and bigger and bigger. And then when somebody else comes in who's leading and has to deal with the back end of that, it's difficult to change the culture. It's not impossible, but it takes a lot of work, and it takes consistency, and it takes a lot of turnover. You gotta turn over a lot of people because that mindset gets ingrained in everything that the organization does. I think the big thing is people want to feel like they're on the winning team. I always vision cast like where we're going as a department. Like, we are going to create a justice involved division. Next year, we're going to tackle, the reintegration and transition issues. I'm always kind of talking to the team about like where we're going, getting them excited, setting goals. Like, my goal is like, you love your job so much, like on the weekends when you're talking to your neighbors, you want to talk about what you do. You're proud to talk about what you do. You're proud to talk to your kids about where you work at. So it's really, building a winning team mentality with your team. The other piece is being flexible. Like, I've heard the exact opposite. Some leaders like allow anything to happen. Some leaders are just going to drop the hammer on everything, which, that doesn't make sense too. At some point you got to allow your staff to take care of themselves. You have to message to your staff, you have to take care of yourself, and you're going to get support from me and the rest of the leadership team, because without you having everything going for you, you're not going to be as available to the veterans that need our help, and your quality of life outside of work is going to falter. So, just understanding, some of our staff have a lot of medical appointments at the VA. Just communicate ahead of time. We can plan around it. It's not hammer time whenever there's a staff issue where they can't be at work. So it's really, just setting the standard high, like we all learned in the military. Like, just have a high standard as a leader, like this is what to expect. And, if you don't meet the expectations, we're going to have a conversation. It might turn out that you're struggling, but I'm still going to reinforce the expectations and try to work with you to give you whatever flexibility I can to help you meet the mission. But you're going to meet the mission. Otherwise, you need to go out on medical leave or exhaust one of the dozens of things that you can do as a public sector employee to take time off that you need to take care of yourself. But yeah, it's a really important question, Kristine. It's really the difference of, veterans getting the help they need or veterans not getting the help they need is good leadership.
That's true. I like how you, as you were talking about like setting goals and coming together as a team, like that cohesiveness can actually create an opportunity for somebody that might be struggling a bit to find the support that they need. And then, you know, if your team's comfortable and your leadership is open and like willing to support you, like that's the time you can come forward, you know, as an employee to say, maybe, you know, I am a little stressed. I could use a little extra help. You know, I could go to the Cohen clinic, you know, I could, you know, get these support that I need to do my job and continue to do my job. So yeah, no, I like how you were saying that. But yeah, you know, it is, you know, we all need to be present for work and show up, and but having a you know, leadership chain of command that's aware that, you know, some days we can have bad days and some days we need a little extra help, and having the ability to step forward and say that and get the help that we need. Awesome. Awesome. Thank you for that. Next we're going to move to Dr. Lynn. And I wanted to just to circle back and ask you.
I'll be right back.
Okay. Is as a long-term provider of mental health wellness, what is your message to veterans and their families thinking about getting support?
Well, the first thing is to recognize that they have to be willing. You know, there's a certain I can do this myself mentality that I've noticed, but true victors, like if you're an Olympic athlete, you have a whole bunch of people supporting you. If you can be vulnerable enough to say, hey, I need some help, or if they're grumpy and they're not talking to their children or yelling at their spouse, you know, this, rather than taking it personal, they could say, is there anything I can do? You know, you'd like to talk, share. You can read people's body language, especially if they're family members and you have an iota of ability, then you put out a safety net, because you can't make them talk. You know, my father-in-law lived to be 99, and he was with the 101st Airborne, and they never talked about anything except 4 times a year they got together. And so we need a community. So with our family members, if we can extend grace, take nothing personal, if they're short and angry, I have a spiritual mantra that I use, which is never said out loud, which is God bless you, I love you, peace be still. And when it's said silently toward that person, unconsciously they'll accept it or reject it. But I've watched couples that were throwing things at each other, and I would just sit there and inwardly I'd say, God bless you, I love you, peace be still. God bless you won't hurt anybody. I love you won't hurt anybody. And peace be still is a commandment for our ego to take a chill pill. So that's the spiritual aspect. And that, when said on under our breath, not as a showing thing, but as a gift, it can change things. 2 weeks ago, I worked with a Vietnam vet who I'd worked with 40 years ago, and he's in a retirement community. And I had an urge to call him, and I said, he goes, lady, I'm so glad you called me. I said, well, it's so nice to talk to you. He goes, what's up? Well, I was dating a woman who would say, are we there yet? Are we there yet? Are we there yet? And he said, I just had to break it off, but I'm going to move to Oregon because I can get an assisted euthanasia for myself. And I said, what in God's name are you talking about? You took care of all those World War II veterans, and you took them to their doctor's appointment, but I'm useless here. I said, couldn't you do a silent ministry? What do you mean? God bless you, I love you, peace be still. Those words allowed him to know that he had value. And in that value, he now had a mission, which was a silent ministry, because, you know, if you're at all aware and people are mad at you, you'll pick it up. So when veterans are depressed or they're angry, it's not rocket science if you can listen. So there's simple ways that we can not be pushy, but hold a space for our family members that come home and they're messed up and their heads aren't on straight. And that silent, simple transmission, let's call it, allows there to be a peace that comes to veterans. It's incredibly powerful. I've used it with vets from Afghanistan, people with burns over 95% of their body, and by God, they lived. One of them happened to be my nephew. And in that context of expanding beyond ourselves and offering this gift, you know, spirituality, it's different for everybody, but whatever breathes us, I'll call spirit. So when we can extend our loving just silently, even if they're driving us nuts, it'll create a shift. I've seen it, oh my God, almost 100% of the time over the last 40 years. And I use that for myself because I too have had massive trauma, post-traumatic stress. I still jump at loud noises, and yet I've been able to tame the beast inside of me by going to myself, God bless me, I love me, peace be still. And so those are some of the simple things. I'm not sure I got what you asked, but that's what came forward. And in that context, we can begin to knit what was broken back together.
Yeah, that's fantastic. I just don't even know where to begin to talk about like all of the amazing things and the work that you've done all over the years. The best I can say is that we have put your link in the chat. If anyone is interested in a spiritual, different model, just something outside of the norm, and as we, you know, like we all know, one size doesn't fit all. That's why we're all here having this conversation, that there are so many different avenues and opportunities and ways to get support. And if you try something and it doesn't work, let's circle back and try something else. Like we have this broad array of support right in front of us right now. So there is an opportunity. So thank you for that. And then we're going to move to Shad and to bring us home for the panel. And this is the loaded question. Are you ready? What would you like everyone to take away from today's panel?
First statement would be everything that's been shared, because it's too bad the whole nation doing in this arena of work is not listening, because there are so many resources. And I mean, from the spirituality to the Cohen group, which is all over the country, to us covering the whole country by a phone bank, doing crisis calls and having to refer vet centers, which was a big part of my life for many years. And I transitioned from that to the foundation, because I realized, my opening statement is, it's important where you start when you get out. It's something had to be fixed. And to me, it's being there, giving that warm handshake, which I've tried. We had one VA hospital did it in the 70s. They had an ombudsman that met every veteran as they walked into the VA. And it was incredible. And he was a vet. It was the only hospital, only one in the country. And it was that interconnection, vet to vet thing. That's one way. There are many other ways. I mean, we didn't have women groups because there were no women primarily other than Donut Dollies and what's the other one? I almost said UFO, but it's the USO women. And I worked with them. Actually, in Vietnam, they had crisis, and I was the only therapist in the country that worked with female vets, Vietnam female vets, which were nurses that didn't consider themselves veterans, even though they suffered along with me in MASH hospitals or whatever, trying to save lives. And then the last 20 years, we now have women combat vets mixed in. And when you have 26,000 sexual assaults in the military in an average year for all branches, that says something that needs to be addressed. And one of the ways I addressed it when this came out was hiring Kristine, because I needed a woman, because I knew this type of trauma, woman to woman, it's what as Esperansa was talking about. They're not comfortable. They're not comfortable going to the VA when there's 150 guys sitting out there waiting for whatever in front of every VA, and they've got to walk through there, and it never worked. So there's simple things, and I think the important thing is everything that was shared here from Jim, the VPAN program he started, the fact that who you hire has to have their heart in this kind of work. This isn't a paper pushing job or a computer job. This is dealing with people with trauma, and trauma takes a special person, a special listening ear, a special way of handling and listening. It just does. And everybody can say, well, I'm a therapist, I'm a psychologist, I'm a doctor, whatever. They don't know trauma. Listen, I was president of the International Trauma Association worldwide. I met trauma from all over the world, and I know trauma is everywhere, but it takes someone that understands it's going to work with the PTSD at any level. Anybody can suffer it at any time, but you can't just be generic and say, hey. I mean, I think Jim brought up the VA. The big thing that I had when my career started at the VA was it was a job. You know, everybody was looking, it was pretty good pay. You got benefits, you got good leave, and boy, 30 minutes for coffee break, this or that or whatever. It was not about, in general, about veterans. And that's how I got my nickname, the Madman, in the VA. It was before the vet centers, because I was like, wow, I'm having to go out. Nobody wanted to deal with them. They were afraid of them or whatever. Today, we have so much more knowledge. We have the definition of PTSD. We have all these therapists that are concerned. We have the Jim Zenners in the world that are taking the hand off. I mean, I've been doing this 53 years, by the way. Don't cut me 3 years short. Those first 3 years were hell. But it's just, this is important that we do this for people that are in this work. And the VA should be in this, to whoever's running that, because they need, if they're going to have people working with veterans, they need to know about the veteran experience. That's what I want to share. And everything that was shared here, from Dr. Lynn all the way to Ava and Esperansa, and Kristine knows well, and Jim and other folks, it needs to get out there, because as much as it's changed in the last 53 years, it's not even close to what I thought it would be back in the early 70s. And with all that we've learned or whatever, it seems to be in general that it's become just a job, and how much you're going to get paid to do it or whatever. And I think fortunately, and unfortunately, the nonprofits are doing the work for veterans primarily, because every vet that has a bad experience with the VA calls our number nationwide. Not that we're not their VA or whatever, but they have a bad experience, and one bad experience leads to another, and it leads to an attitude, and the attitude is no gratitude about anybody, and then it just spirals out. So I'm just honored that Kristine and Dom put this together, and I'm really honored to know everybody. I know I've met Esperansa, I know Dr. Lynn, Kristine, Jim, but this work is so important. And, you know, I'm 53 years in this, and I'm still a madman. I really think that we have to all come together and share whatever, because that's one of the biggest problems with nonprofits. There's like 2 million. They don't, you know, it's like everybody's in their little bubble. And I never, you know, I say we collaborate with everybody, and we have to, because we're covering the whole country, and we're just a small A team. But it's so important, because all of our people, most all of them, are combat vets, disabled vets, and they feel it. And then we got all these experts, like social workers right in front of us, doctors and whatever. We need to all come together. It's like the same problem with climate change. You know, one city will do it and the rest of the world doesn't. Nothing's going to happen. So that's my closing statement. God bless this group, and let's keep doing it. Let's invite more people. I hope the whole world gets to see this.
Oh, I think as do I. So thank you for that. We're gonna wrap up. Thank you all for taking the time today to have this conversation. All of the information about your agencies has gone in the chat. Just a reminder, this is recorded. It's going to be posted on the NVF website. Where I did see one question come in, we'll post that with the recording on the website. And I just would love to leave with kind of a little summary from today. Just some things that really stuck out with our second round of questions is, you know, the question is, where do we start? So if you know something, tell somebody what you know and keep it going, and you're be willing to share the information, especially what we learned today about the different agencies and what's going on and how valuable the vet to vet connection is. It's easier to talk to somebody that's walked in the same boots as you have. So keep that going. And I encourage all the other veterans out there, if you have a question, ask another vet. And if they don't know, then take the two of you and ask the same question to somebody else until you figure out the solution for that. I love what Shad said, a special listening ear. And I think that goes back into what Dr. Lynn said, like having some grace for those that are struggling, and for those that are beside us and our family, whatever we decide who those people are, to share their grace, and then to have that listening ear. I think that's fantastic. And you know, here we are today sharing knowledge, and we all know knowledge will get us much further along in how we support veterans and their families and the community in addressing our mental health needs and provide more support for everyone. So I believe we are at time. Thank you, everyone. I personally appreciate your time and dedication and the work that you do every day, and especially that you spent an hour with us today. So thank you for that. I do not believe we have any questions, so we can just wrap up here. And if anybody has any second thoughts or anything else they forgot to mention they'd like to share later, just get connected with us, and then we will post it with the recording. So with
I'll
that,
say one last thing.
yeah.
I said I wasn't talking. We're so busy, at least everybody here. I know, I mean, particularly the people I know, like you, Kristine, and Jim. I can only assume with Ava and Esperansa, and I know Dr. Morel. We just don't get together like this. So this is a good way to send this out to people, because nobody takes the time to sit and meet and find out and feel each other out and see our history or whatever. I mean, this has been great. I'm just elated that this happened. I can eyeball all you superstars. Just makes me feel great. So, and Ava, don't forget to call me.
All righty.
Please
Thank
let
you
Claire know
all.
I said hi, Ava.
Everybody.
Good to
Bye,
see you.
Jim.
Thank you.
Esperanza.
Thank you. Thank you, everybody. You too, Jim and Shad and Kristine, and nice to meet you, ladies. Thank you.
Thank you.
Great talking to you all.
Take care. God bless y'all.
Thank you.